Hello, this is Dr. Kevin Kirby. This lecture is going to be on modern biomechanics and engineering terminology for the podiatrist. Specifically, we're going to be talking about both rotational and translational equilibrium. I've been teaching biomechanics, sports medicine, and foot orthotic biomechanics for the past 30 years, both at the California College of Podiatric Medicine in San Francisco and now at the California School of Podiatric Medicine in Oakland, California. Equilibrium. What is equilibrium? Equilibrium is a condition when all the forces acting on an object are exactly counterbalanced. Equilibrium is based on Newton's second law of motion, where F equals ma, or force equals the mass of the object times acceleration. So that if we have an object that's not accelerating, or their acceleration is equal to 0, then the net force acting on the object, F, must be also equal to 0. So, when we have an object that is in equilibrium, either when it's at rest, which is also called static equilibrium, or the object is moving at a constant velocity, or rotating at a constant velocity with no acceleration, then it's going to be in equilibrium. In the example I have here, I have a ball of homogeneous content with a center of mass in the middle, being accelerated downward by gravity and creating a force on the ground it's resting on. So to be in an equilibrium situation where it's not moving, we know that the ground reaction force, with the ground pushing upwards on the ball, must be exactly equal to the force from the ball caused by gravity accelerating its mass toward the ground. Those two forces, the upward force from the ground and the downward force from the ball, must be equal to 0 so that no acceleration is occurring. Translational and rotational equilibrium. Translational equilibrium means that the object is either at rest or moving along a linear path at a constant velocity. Translational equilibrium means linear path types of equilibrium, moving from side to side or forward or backward. When any object, let's say for example, is at rest on a table, it's going to be in translational equilibrium because it's not moving along a path. It is actually in static equilibrium. Rotational equilibrium, on the other hand, is when there is an object and this object is either at rest or rotating about an axis of rotation at a constant rotational velocity or angular velocity. In the example below, I have a condition of rotational equilibrium of two children on a seesaw. I have a girl on the left and a boy on the right. We know that the seesaw is not moving, so we know it must be in rotational equilibrium. The downward force from the girl acting across the axis of rotation to the point where that girl is sitting, its moment arm, is going to be producing a counterclockwise moment, or a tendency of that girl to force the seesaw downward on the left-hand side in a counterclockwise direction. The boy, on the other hand, is acting across a moment arm from the axis of rotation to his body weight to produce a clockwise moment, or a tendency for his weight to force the seesaw downward on the right or in a clockwise direction. So, if we see these two children resting with their feet off the ground and the seesaw is not moving and level, then we know that it is in rotational equilibrium with the counterclockwise moments from the girl's weight being exactly counterbalanced by the clockwise moments coming from the boy's weight acting across their respective moment arms relative to the axis of rotation. In translational equilibrium, we can use Newton's second law of motion, or F equals ma, or force equals mass times acceleration, to make fairly accurate assumptions regarding the forces acting on objects or between objects, so that when the acceleration of an object is equal to 0, the net force on the object must also be equal to 0. In the example I'm describing above, we have a 100 Newton box, or a box that weighs 100 newtons, pushing downward on top of a platform. 100 newtons is 22.5 pounds. 100 newtons is also 10.2 kilograms times the acceleration of gravity, which is 9.8 meters per second squared. So, when we have this 100 Newton box pushing down on the top of the platform, we also must have a force pushing upward from the platform on the bottom of the box. So, do we have enough information here to calculate what the force from the platform is pushing on the bottom of the box? Well, of course we do, because we know it's an equilibrium, and we know in order for equilibrium to occur, the forces must exactly counterbalance on an object. So the upwards force from the platform must be 100 newtons, and the downwards force from the object is 100 newtons. That's the given. So we can calculate that force between the box and the platform as being 100 newtons. In a separate example, same box on the right, I've now attached a rope and I've pulled upwards with a 60 Newton force on top of the box. What is going to be this force now between the platform and the bottom of the box, given that I've not moved this 100 Newton box off the top of the platform and it's still in translational equilibrium? Well, we know that the downwards going force from the box pushing on the bottom of the platform with 100 newtons must be exactly equal to the upwards force of the rope combined with the force from the platform pushing upwards, so that we know that that force must be 40 newtons from the platform pushing upwards, because 40 plus 60, the two upwards forces, must equal the 100 newtons force, which is going downwards, to remain in translational equilibrium. The concept of rotational equilibrium is very important for us to understand the kinetics of the joints of the foot and lower extremity. Now, what does kinetics mean? Kinetics means forces and moments acting on and within the joints of the foot and lower extremity. So that, in other words, in all human locomotor activities, whether it's walking or running or hopping or skipping or jumping or just standing, what causes a joint to accelerate? What causes a joint to decelerate? Why do these actions occur? And what exactly is happening when a joint becomes stable and is not moving or resists movement? These are the things that rotational equilibrium, that physics concept that's so important, allows us to better understand. We've already looked at the seesaw of the boy and girl being on opposite sides of the seesaw, but let's again look more closely at the moments and how they can be calculated. So, to summarize, rotational equilibrium means that oppositely directed moments are exactly balancing. So in the situation of the seesaw that I've drawn here, we have a 200 Newton mass on the left-hand side of a seesaw and a 200 Newton mass on the right-hand side of the seesaw. The length of the seesaw board is 6 meters, and the axis of rotation is in the center of the seesaw board, which in this situation I'm going to say has no mass. So that the moment arm on the right is 3 meters times a 200 Newton meter mass is going to produce 600 Newton meters of clockwise moment. On the left, the 200 Newton meter force going downward across a 3 meter moment arm is going to be producing a counterclockwise moment also of 600 newton meters. Since the counterclockwise moment of 600 newton meters exactly balances the clockwise moment of 600 newton meters, then we know that the seesaw is in rotational equilibrium because the opposite moments exactly balance. So that in this situation, if we saw this seesaw resting, not moving, we know it's in a rotational equilibrium, and we know that the clockwise moments and the counterclockwise moments exactly balance, and this is what produces the condition of rotational equilibrium. In this slide, we're going to be talking a little bit about the rotational equilibrium in a seesaw that can then be made to have acceleration and then back into a situation of rotational equilibrium again. In the first situation, which we showed on the last slide, we see that rotational equilibrium has occurred because the counterclockwise moments on the left are exactly equal to the clockwise moments on the right. The board is still, and we have a situation of static rotational equilibrium. However, when we have an unbalancing of moments across an axis, this is when we're going to be getting an angular acceleration of across the axis of rotation, whether this is a seesaw board or even in a joint of the foot such as an ankle or subtalar joint. In this situation, the seesaw, we have moved the axis of rotation 1 meter to the left, so now we have a 2 meter moment arm on the left and a 4 meter moment arm on the right. This creates an unbalanced moment situation where the clockwise moments now on the right are 800 newton meters and the counterclockwise moments on the left are only 400 newton meters. Because the clockwise moments are now larger than the counterclockwise moments, we are going to produce an acceleration of the seesaw board into a clockwise rotation, and this is not a situation of rotational equilibrium because we have an unbalanced set of moments. What happens next is that the board will obviously rotate in a clockwise direction until it hits the ground, and when it hits the ground it's going to stop rotating again and have a new position of rotational equilibrium. However, the situation here is that no longer are just the 200 Newton weights on the left and the right side contributing to the force in the system, but now we have a ground reaction force acting on the right hand side of the board pointing upward that prevents the board from rotating further. This is another point of stability for this board. It's a very stable situation, but it also is a situation of rotational equilibrium. So this rotational equilibrium situation is a situation of stability for this axis of rotation because now the clockwise moments on the right hand side that in the middle slide here were overwhelming and causing a rotation in clockwise direction are now being stabilized by this 100 Newton force pushing upward on the right hand side of the seesaw. This balancing of moments is one of the ways that we might achieve joint stability in the foot and lower extremity by balancing of moments. When we look at that last slide at the bottom, where we have reached the point of where the right hand side of the board has accelerated, struck the ground, and is now again in a rotational equilibrium and not moving, we can see that the clockwise moments on the right, 200 newtons times 4 meters is going to be 800 newton meters. On the left hand side of the board, the 200 newton weight acting over 2 meters is going to equal 400 newton meters. So we have a balance of 400 newton meters in order to produce an equilibrium, and that must come from a ground reaction force of 100 newtons acting over the 4 meter distance to produce the extra 400 newton meters of counterclockwise moments that must be required in order to maintain equilibrium of the seesaw board. So you see, using this idea of equilibrium, both translational and rotational, allows us to understand the forces within an object and acting on an object much better than we could if we didn't have this available for us to use to understand how things work and calculate the forces that are occurring in objects when they either stop rotating or accelerate into rotation or decelerate from a accelerated position. In the special example of the subtalar joint axis, which has been a special interest of mine for the last 30 years, is that the subtalar joint has a relatively small range of motion, and many patients we see are maximally pronated. And one of the things I became interested in 3 decades ago was what was the special conditions of the maximally pronated subtalar joint where many of our patients are functioning in and standing in during weight-bearing activities. In other words, what are the internal forces that cause the subtalar joint to stop pronating at the maximally pronated position? In our example above, we have a model that I created. Here's where the model, I've combined the talus and the tibia into one unit. Here's the model of the calcaneus. Here's the medial forefoot on the left and the lateral forefoot on the right. Here's my model of the subtalar joint axis. So the lateral aspect would be actually the sinus tarsi. And this model allows us to understand how the back of the right foot would look in certain situations to try to simplify this understanding of subtalar joint maximum pronation and how it occurs and how it can affect many of the functional and biomechanical factors within the foot and lower extremity. So to induce a maximally pronated position in a patient who is not standing in a maximally pronated position, we have 2 ways of doing that. We can either have the patient use their perineal muscles, including the peroneus brevis or peroneus longus, to exert a subtalar joint pronation moment that is going to make the sinus tarsi occlude by the lateral process of the talus sliding down into the floor of the sinus tarsi. Or we can also do what's called the Coleman block test, where we have the patient stand on a block on the lateral side to maximally pronate the subtalar joint. Again, here we have, instead of muscle force producing the maximally pronated position, we have ground reaction force producing that maximally pronated position, again causing a external subtalar joint pronation moment, again causing the subtalar joint to reach its maximally pronated position because the lateral process of the talus has fallen down into the floor of the sinus tarsi of the calcaneus. One question that I had early on was that why are some feet more difficult to supinate from the maximally pronated subtalar joint position than others? We see this with the supination resistance test that we described back in 1992, is that some feet are more difficult to supinate than others. Specifically in regards to rotational equilibrium across the subtalar joint axis, we have a very special situation within the subtalar joint range of motion when the foot has reached its maximally pronated position. However, let's first look at the mid-range of motion of the subtalar joint, going from a position of supination to neutral to the point of maximum pronation. In this situation, when we move the foot into neutral and then to pronated and back to neutral and supinated again, we have a relatively free range of motion of the subtalar joint where additional pronation moments will cause pronation motion of the subtalar joint and additional supination moments will cause supination motion of the subtalar joint. So if we add in pronation moments, the foot's going to pronate, and if we add in additional supination moments, the subtalar joint's going to supinate. However, once we've reached the maximally pronated position, these free movements in response to additional pronation and supination moments don't always occur. And this has been a topic of special interest to me for the past 30 years when I've done my research on subtalar joint axis location and also rotational equilibrium across the subtalar joint axis. So when we reach this maximally pronated position of the subtalar joint, and this is caused by the lateral process of the talus striking against the floor of the sinus tarsi of the calcaneus. When we reach that position, there is exerted a interosseous compression force between the lateral process of the talus and the floor of the sinus tarsi of the calcaneus. So that as pronation moment is increased, we are going to get an increase of this interosseous compression force. And from this maximally pronated position, if we decrease the pronation moment, we are going to get a reduction of that interosseous compression force between the lateral process of the talus and the floor of the sinus tarsi of the calcaneus. So, going from the position of where we're just lightly pronated here, then we add a little bit more pronation moment. The interosseous compression force increases slightly. We add a little more pronation moment, and increases even more. And if we add a great amount of pronation moment, that interosseous compression force increases even further. So, this means that feet that have excessive pronation moments may not continue to pronate, but that excessive pronation moment must be resolved somewhere, and this is resolved within the sinus tarsi, causing the lateral process of the talus to smash against the floor of the sinus tarsi of the calcaneus, which in many instances can cause symptoms such as sinus tarsitis and sinus tarsi syndrome in patients who have these excessive subtalar joint pronation moments. Next, let's look at the ankle joint and how equilibrium and understanding equilibrium can help us understand the forces not only within the ankle joint, but also the compression forces that occur between the top of the talus and the bottom of the tibia. First of all, let's look at this model I've created. We have an individual laying on a table. Here's our tabletop. I've modeled the tibia to be just one block of bone, and I've modeled the foot to be just one block of bone in order to simplify our model. I've included the Achilles tendon along with the gastrocnemius soleus, here with the individual laying on the table with their foot hanging off the end of the table. And what we're going to be doing is checking ankle joint dorsiflexion by pushing with our hand underneath the forefoot. In this model, I'm giving you that there's a 10 centimeter moment arm between the place where we're pressing on the forefoot and the ankle joint axis, which is here, and also that there's a 5 centimeter moment arm between the Achilles tendon and its attachment on the posterior calcaneus to the ankle joint axis. So, when we push with 40 newtons of force, which is about 10 pounds, underneath the bottom of the forefoot, across a 10 centimeter moment arm, can we then calculate what the force in the Achilles tendon is, assuming the Achilles tendon is the only muscle that's active with contraction or even with passive tension in the series elastic elements of the gastrocnemius soleus muscle? Well, of course we can, because we know about rotational equilibrium. We know that this Achilles tendon force must be 80 newtons, because we know that the dorsiflexion moments coming from our hand pushing on the forefoot must exactly be equaled by a plantar flexion moment coming from the Achilles tendon pulling on the back of the calcaneus. And when we do the math, we find that now in this situation, the forefoot is no longer dorsiflexing. The foot is not dorsiflexing on the ankle. It's in rotational equilibrium, and because it's not moving and in rotational equilibrium, we can know that this Achilles tendon force is 80 newtons. From this, can we also then possibly understand what the force is at the ankle joint? Well, we should be able to because of translational equilibrium, where we know that the force is pushing from right to left, or the 40 Newton force from our hand pushing on the forefoot, and the 80 Newton force from the Achilles tendon pulling the calcaneus from right to left. Those add up to 120 newtons pushing the foot toward the right. So what does the force of the ankle joint have to be? The force of the ankle joint has to be 120 newtons. So the 120 Newton force from the ankle joint, at the ankle joint, with the tibia pushing the foot toward the right, has to be equal to the 40 Newton force from our hand pushing the foot to the left and the Achilles tendon force pulling the foot to the left. In this way, we've used both the ideas of rotational equilibrium and translational equilibrium to solve not only for the Achilles tendon force, but also for the ankle joint compression force without having to put in a sensor, open up the foot, put in a force cell or a transducer to do so. It is not exactly accurate, but it gives us a good way to estimate the forces in these structures, and this is the power and beauty of understanding equilibrium in foot and lower extremity biomechanics. When we start using the model again from the last slide, I want to reemphasize how we use translational equilibrium and rotational equilibrium to solve for not only Achilles tendon forces but also ankle joint compression forces. Then how that can also be used in this situation using a modeling technique called a free body diagram. So again, to review, translational equilibrium means that all the forces acting from the left, manual force from our hand pushing on the forefoot, and the Achilles tendon force pulling on the back of the calcaneus from right to left, has to be equaled by the tibia pushing the foot toward the right, so that translational equilibrium is achieved, so that both the forces to the right and forces to the left acting on the foot are exactly equal. The foot is still, it is not moving, and it is in translational equilibrium. Again, also rotational equilibrium means that the force from our hand pushing on the forefoot is creating a magnitude of ankle joint dorsiflexion moment that must be exactly equal to the ankle joint plantar flexion moment coming from the Achilles tendon pulling on the back of the calcaneus. And it's only when those two forces, the plantar flexion moment from the Achilles tendon and the dorsiflexion moment from the hand pushing on the plantar forefoot, when these two moments are exactly equal, that the foot will rest in place, it will not be moving, and it will be in rotational equilibrium. In physics and in engineering, there's a technique that's commonly used, a modeling technique called a free body diagram. And this is when we take an object and we depict it as a model as though it was isolated, but with all the forces acting on it. And these may be forces coming from the bottom of the foot, in this example of my foot. Here's my manual force from my forefoot. It could be that Achilles tendon force pulling from right to left on the posterior aspect calcaneus, and it could also be this ankle joint compression force coming from the tibia pushing on the top of the talus from left to right. But we see a free body diagram is a situation of equilibrium where these two forces of the 100 Newton force from on the forefoot and the 200 Newton force on the Achilles tendon moving toward the left, or pushing toward the left, must exactly equal this force from the tibia pushing the foot toward the right. And also it must be in rotational equilibrium. So if we know that this distance here from the ankle joint to the forefoot is 10 centimeters, and the distance from the ankle joint to the posterior calcaneus is 5 centimeters, and this is going to allow this object, the foot, assuming it has no mass, which I've eliminated to make it more simplified, will allow it to be in equilibrium, both translational and rotational equilibrium. So we see this free body diagram is a fairly simplified model, but does allow us to make certain predictions in regards to possibly muscle forces and also joint forces in models of the foot and lower extremity. We can use these ideas of rotational and translational equilibrium and put them to clinical use in estimating something such as loads on ankle implants. When we're designing an ankle implant, we have to be worried about the forces that go through it, because this will determine how the ankle implant is designed and will determine how the ankle implant may over time wear into the bone or cause loosening of the ankle implant and possibly needing to replace it in the future after the surgery. So we can use our techniques of free body diagram analysis here on the right and our model on the left to better understand the forces going through the ankle joint. In this situation, I've actually have now a foot that's standing slightly on its tiptoes, and we're going to be looking at this as a model as a way to understand how much force goes through the ankle joint. So if this patient is just standing on one foot, we have ground reaction force pushing upwards on the forefoot. We have Achilles tendon force resisting that, pulling upwards on the back of the calcaneus. These two create a situation of rotational equilibrium that is necessary, but they also create a situation where both the Achilles tendon force and the ground reaction force, since they're upwards going forces, must be exactly counterbalanced by a downwards going force from the tibia onto the top of the talus to create a compression force. If we do the calculations for this, and we transfer here to our free body diagram where we've taken the foot out of the model, here's our ground reaction force acting on the plantar forefoot, and the patient is just standing in a slight tiptoe position on one foot. We know now that the force in the Achilles tendon must be double of ground reaction force. And we also know now from our analysis of our free body diagram analysis that the ankle joint force, in other words, a force from the tibia pushing downwards on the dorsal aspect of the talus, must be 3 times the ground reaction force. So in this situation where we have a free body diagram and also model on the left, we see that if the patient is standing on one foot with the heel slightly elevated with dimensions of the foot basically that I've shown you here, and they weigh 200 pounds, the ankle joint compression force must be approximately 600 pounds. And this is confirmed by previous research. Stauffer et al. In Clinical Orthopedics in 1977 showed that ground reaction force through the forefoot, an upwards force, combined with the tensile loading force through the Achilles tendon, also an upwards force, must mean that ankle implants will be subjected to compression loads of at least 3 times the body weight. So this idea of using modeling techniques and free body diagram analysis allows us to understand these better, why the ankle joint receives such large compressive loads, and possibly why it has been so difficult in the past 50 years to design long-lasting ankle implants that can resist bone compression and loosening over time. In conclusion, we've seen how the ideas and concepts of translational equilibrium and rotational equilibrium can allow clinicians and podiatrists to better understand how both forces and moments can not only cause joint motions, accelerations, decelerations, and also joint stability, where we have a situation of rotational equilibrium occurring. In understanding these internal forces and internal moments allows a podiatrist to then understand the internal forces, whether that's a compression force through the ankle joint or the first metatarsophalangeal joint, or let's say through one of the joints of the Lisfranc's joint, or it's understanding the tensile forces in the posterior tibial tendon, Achilles tendon, or even in the ankle ligaments, such as the anterior talofibular ligament or the deltoid ligament. These modeling techniques allows us to better understand the internal forces and moments within the foot and lower extremity. This is going to better allow us to understand foot and lower extremity biomechanical pathologies, how they're created and how they're best treated, and then design better treatments for our patients to help ensure that they lead happier and healthier lives. Thank you for your attention on this biomechanics and engineering concept of equilibrium. I'm hoping that these concepts will help you better understand the biomechanical function of the foot and how to best treat foot and lower extremity biomechanical pathologies in your patients.